Hello everyone, welcome and thank you for joining us for today's webinar on a new regulatory strategy for aged care. My name is Janet Anderson and I am the Aged Care Quality and Safety Commissioner. I will be chairing today's session. Let me start by acknowledging the traditional owners of the lands on which we're meeting, wherever you are in Australia, and paying my respects to elders past and present, and extending those respects to any Aboriginal and Torres Strait Islander people who are joining us for today's webinar. Joining me today as part of the presentation team, I'm pleased to welcome Lisa Peterson, who's the Deputy Commissioner, Sector Capability and Regulatory Strategy in the Commission, alongside Peter Edwards, the Executive Director for Compliance Management. And there will be two other Commission staff who also come in towards the end of proceedings to assist with answering your questions, and they are Emma Jobson, Executive Director, Regulatory Strategy and Policy, and Anthony Speed, Executive Director, Quality Assessment and Monitoring. Before I start, a few housekeeping details. We do encourage you to ask questions on the way through. Just use the question box via the live Q&A tab, which should be visible on your screen. We also have a short survey for you to complete at the end of the webinar. Please do so. It won't take you long. It's a very quick survey, but we are very keen to hear from you. What did you think of today's session? And what would you like us to cover in subsequent webinars? We do appreciate your feedback. We are recording today's webinar and we will be publishing it on our website in coming days. Everyone who registered for today's webinar will also receive a link in your emails. So as I said, we're talking about the Commission's regulatory strategy for 2024-25, which in many ways could be considered a foundational document for the Commission because it underpins every regulatory decision and action we take. This isn't the first time we've talked about the core elements of the strategy, but we have been refining it in response to various bits of feedback we've received. What Lisa's going to do is to take you through the strategy and what the Commission is focusing on and what we expect from aged care providers. Our regulatory strategy is essentially founded on best practice principles, which can be distilled as: we aim to be fair, balanced and effective in all that we do. Our approach to decision making should be consistent, transparent and designed to ensure that any intervention by us is made at the right time and in the right way. Our delivery on these aims will enable you as providers to understand what's expected of you, and for older Australians to be confident that we will always intervene appropriately to safeguard and protect their health and well-being. That's the reason we exist. Now, to help bring this to life, Lisa will be followed by Peter, who will showcase a few case studies to help every one of us understand the practical implications of our approach. And Peter will be discussing examples of heightened, active and targeted vision, so you can gain a clearer understanding of what our strategy looks like on the ground. And as I said, after Peter's presentation, we will move to a Q&A session. So I do encourage you to use the opportunity to put your questions in, and we'll get to as many of them as we have time for. But let me start by introducing Lisa, Deputy Commissioner, who is going to give us a user's guide to our regulatory strategy 2024-25. Thank you, Lisa.
Thanks so much, Janet, and hi everybody. Thanks so much for joining us for the conversation this afternoon. We are really excited to be sharing our 24-25 regulatory strategy with you. Now, elements of our strategy have already been presented in a number of different public forums, so you might have already heard a little bit about it. And we've also been consulting with different groups about it, so including the Commission's Advisory Council, the Department of Health and Aged Care. We've spoken to ACPA and industrial associations that we'll be talking with OPAN and COTA later in the week. And once we finalise the strategy, the intention is to publish it on our website, and then we'll be socialising it through all of our different sector engagement opportunities. So, as Janet's outlined, the purpose of the regulatory strategy is really to set out how the Commission will deliver on our goals and commitments. And the current strategy was last updated in 2020, and the Commission has certainly evolved and matured since then. we've definitely, I think, increased our capabilities and also become a bit more sophisticated and nuanced in our practice. And it's important that we reflect this in the new strategy. And we know that transparency around what we care about, what we expect from providers, what older people can expect from us, and how we regulate is really key to building trust and confidence in the Commission. And we know that there's a really strong appetite amongst providers and older people to know more about how we think and how we work. And we've been working hard on improving our transparency in all sorts of different ways. And the annual publication of the Commission's regulatory strategy is a really important part of that story. And this was something that was also identified by the independent capability review of the Commission. So really delighted to be here today and able to share it with you. Now, our strategy is informed by principles of best practice regulation, and these are set out by the Department of Finance and they apply to all Commonwealth Government regulators. And there are three principles: continuous improvement and building trust, being risk-based and data-driven, and a principle around collaboration and engagement. And you'll see examples of the principles in practice in the strategy, in how we're building a culture of continuous improvement across the Commission to boost stakeholders' trust and confidence in us as the regulator. We're developing our capability to undertake increasingly more sophisticated analysis at both the provider and the sector level to help us to prevent and respond to risk. And we're collaborating with older people and providers and workers to improve the quality and effectiveness of our communication and education materials. I also would note that our strategy very much reflects our current operating context. And as you'd expect, we are positioning ourselves to be ready to regulate under the new Aged Care Act, the new regulatory framework, and the strengthened standards. And at the same time, we're really maturing and evolving our regulatory craft. And you'll see that in some of the new approaches that we talk about in the strategy. So what do we care about as a regulator of aged care in Australia? That really drives our approach to regulation. So our goal is to build trust and confidence in aged care by having a positive impact on the lives of older people. And we care about how well we do that, including our effectiveness in prompting providers and workers to lift their game. And we hold ourselves accountable for how we do it, and rightly so. Importantly, to deliver on these outcomes, we must listen to older people, and we must be fair and balanced and effective and deliver consistent regulatory decisions, and that includes recognising providers who are getting it right. And to be an effective regulator, we must intervene at the right way, at the right time, to safeguard and protect older people. Now, our next slide has a lot of text, but I did want to include it as it really distills the Commission's approach to regulation in its various component parts, including all the different areas where we're changing or evolving our regulatory craft. And I might just ask my friend who's on the slides there to take us to the next one. Thank you. So some of the elements that you'll see on the screen before you have been part of our toolkit for some time, albeit that we're continuing to develop and improve of them, and others are much newer, such as our adoption of a provider supervision model of regulation. But all of the things that you see on the screen in front of you really signpost how we're working towards regulating under the new Aged Care Act, and also I think really serve as a statement of our intent as a regulator. And I'll touch on some of these as we go through the presentation. Now, we want our regulatory strategy to be understood by older people and their families and representatives, and by providers and aged care workers. And so we've distilled our expectations of providers and aged care workers down to key messages. And I'm hoping we can go to the next slide that show those. And the intention here is that providers and workers are very clear about what they have to do. So we expect providers and workers to work with older people in genuine partnership to deliver high quality aged care that supports older people's wellbeing and quality of life. And when things go wrong, and they do, we expect that providers and workers to remedy the problem, so to fix it, and to restore older people's trust and confidence in the care being delivered, and to take meaningful steps to prevent the problem from reoccurring. And importantly, we expect providers to do these things all the time. We're used to hearing the language of restore, for example, most typically in relation to complaints, but we really want to see the restore, remedy, restore and prevent approach used in every circumstance where something goes wrong. Now I want to go to our regulatory diamond, and you'll be familiar with this, I hope, most people. And this did start out originally some time ago as our regulatory pyramid. But the top half of the diamond really is intended to explain how we adopt a proportionate, fair and balanced approach to risk, where providers are willing and able to do the right thing, and we can see that they're striving for excellence in care. And the diamond shows that our expectations don't stop at care that's compliant. Older people in the general community expect more, and therefore so do we. And this top part of the diamond also explains how we safeguard older people by publishing information about best practice care and performance data about the sector. Now, the bottom half of the regulatory diamond really shows how we have eyes on all providers all the time through our risk surveillance and risk-based monitoring activities. And when things go wrong, we adopt a fair and balanced regulatory response through our provider supervision model. And we've shown this with the, you can see the tiered provider supervision status on the bottom left-hand side of the diamond there. These graduated responses show us holding providers to account to ensure that they remedy problems, restore trust, and prevent reoccurrence, or if it's beyond them, then we take enforcement action and, if necessary, exit a provider from the sector. It's really important to understand that the Commission doesn't just regulate in response to unmanaged risks and issues. We're also very actively, proactively engaging with the sector to prevent failures in care. And this slide shows you a bit more detail about how we use risk surveillance of all providers to inform both a responsive and a preventative approach to regulation. So on the left, you can see how we analyse intelligence to identify risks at either a sector-wide level or for a specific group or type of providers. And this helps us then to develop bespoke and really targeted responses that can mitigate those risks and build sector capability. On the right-hand side, you'll see how we engage with providers where there's evidence of risk or harm and how we aim to resolve that risk directly using specific regulatory tools. And we are very active in both approaches all the time. But having said that, responsive regulation will always be at the core of our work and is very much focused on that proportionate approach to reduce risks and harm and to address non-compliance and to deter future non-compliance. The overarching aim of both preventative and responsive regulation is always about improving the care outcomes for older people. Now, I want to tell you a little about the provider supervision model. So under this model, the Commission allocates every single provider a supervision status based on their level of assessed risks. And there are 4 supervisory statuses which correlate to what I describe as an escalating intensity of Commission intervention. So you can see the 4 levels of supervisory status on the screen. So risk surveillance, that applies to every provider. And then we move through targeted, active and heightened supervision. And the level of our engagement with a provider changes as a provider moves across this spectrum of provider supervision. And a provider's supervision status is very much informed by all the ongoing collection of intelligence and risk analysis about every provider. And we get that through the variety of data that's reported by providers, through complaints, as well as being informed by the outcomes of our regulatory engagement with providers. So a provider's supervision status can move up and down that supervision spectrum as new intelligence and information comes to light. And a really important message here is that we're always communicating with the provider that their choices matter, and that's probably what's going to determine their direction of travel. So for a provider who is able to acknowledge their non-compliance, including to the people that they're looking after, and move quickly and effectively to address the shortcomings, then they'll move back towards the risk surveillance status as we continue to monitor them. But where we find a provider that's reluctant or resistant to making the required changes, then we intensify our engagement. And this is where we'll be using our compelling and enforcing regulatory tools. And ultimately, that can lead to a provider being found unsuitable to provide government subsidised aged care and exiting the sector. It doesn't happen often, but it can happen. The provider supervision model, of course, is essential under the new Aged Care Act, where the legislation will require us to regulate providers rather than services. Now, that doesn't mean that we won't be paying attention to what happens at a service level. We absolutely will. But it does mean that we will have a greater focus on engaging with providers on their provider level systems and processes for identifying and fixing problems that we see at the service level. So the law requires all providers to be accountable for the quality and safety of care that they're providing to older people across all of their funded care and services. And then it's our job, of course, to ensure that accountability. We think there are really excellent benefits from a regulatory model that focuses on the provider rather than individual services, because where a problem in a particular service is fixed from the provider level, then it's more likely to stay fixed because the provider's taken responsibility for it. And even better, the problem's less likely to occur in other services that are operated by the provider for exactly the same reason, that the provider has taken responsibility for addressing the issue across all its services. And we see this as a far more effective way of encouraging providers to achieve that sustainable lift in performance of their services, whether they have one service or many. And for that reason, providers can expect that the Commission will have a much greater focus on engaging at the provider level for significant risks and issues rather than service personnel. Our decisions about a provider's supervision status is informed by our data-driven risk profiling, which is fed by the analysis of intelligence that we collect as we fulfil our functions as a regulator. And you can see on the screen all of the different sources of information that come to us. And this data and the way that we use it gives us greater capacity to analyse risk across the sector, as well as in relation to individual providers or workers. And the way that we monitor risk also gives us insights into where we need to respond to a provider or a worker's non-compliance under provider supervision or the code of conduct. And this updated approach to risk monitoring also is really helpful to us in identifying sector risks and developing targeted preventative campaigns, such as our current focus on food and nutrition and dining in residential care. Finally, the enforcement approach. So the Commission's effectiveness in safeguarding and protecting older people's right to quality of aged care depends on our ability to hold high-risk providers and individuals accountable. And enforcement actions are designed to apply a penalty and enforce a consequence for non-compliance. It's really important to know that we don't ever do this without careful consideration. The Commission is most likely to take enforcement action where non-compliance has resulted in significant harm to older people, or it's serious or systemic in nature. And the language that we tend to use to describe this is unacceptable failures in care. And using enforcement actions in the right circumstances helps to deter future non-compliance for all providers and workers by reinforcing the requirement for obligations to be met. And we have a range of enforcement actions that we can use. So imposing a ban on a worker that might restrict or permanently prevent their participation in the aged care sector, imposing penalties on providers and workers by issuing infringement notices or commencing to civil proceedings, imposing sanctions on a provider which will prevent receipt of further funding or restricting the type of aged care services that they can deliver. There's referring an offence for criminal prosecution or indeed revoking a provider's approval to receive funding and deliver aged care. So that is a quick dance through our regulatory strategy. Before I finish, I do want to just remind you that we are very much thinking about 24-25 as a transition year. It's our runway to the new Aged Care Act, and our 24-25 regulatory strategy is focused on that. And we'll be updating our strategy for 25-26 and look forward to releasing that ahead of July 25. Thanks, Janet.
Well done, Lisa. Really great presentation, lots of information there, and the PowerPoint slides will also be made available to everyone watching, because I'm sure that there are a lot of you who want to study it more closely. In fact, there's another Lisa online who has asked whether the information about provider supervision is published somewhere. Lisa online, the answer is definitively yes, it will be. This webinar is a precursor to our publication of Regulatory Strategy 24-25, and in there you will find all of this information about the provider supervision model. So it will be available very shortly, by the end of this month, early in August, and you can read it there too. Wonderful. Let's move on now. I want to introduce Peter. Peter is going to be talking to us about 3 case studies that he has formulated, drawing from real life examples to illustrate the ways in which the Commission engages with varying degrees of intensity with providers where they stray away from compliance. Peter, over to you. Thank you.
Thanks, Janet, and it's really good to be with you all. Good to see so many people willing to come out on a Tuesday afternoon to learn about our regulatory strategy. Look, I'll quickly take you through, as Janet said, 3 case examples of what supervision might look like for a provider, and I'm hoping that will sort of bring to life some of the things that Lisa's just talked about. The first one will focus on heightened supervision, where we did not need to actually use our powers in relation to the provider, but it did end up, unfortunately, needing to take formal action in relation to a worker. The second example is of active supervision, where it became necessary to use our powers to get the provider to take required remedial action. And the third case study is an example of what we're calling targeted supervision, and the case I'll be talking about is where we have focused on a provider's prudential obligations. The example of heightened supervision is a case that involved a serious incident the Commission became aware of that placed a number of people at risk of potential harm. On becoming aware of the incident, the provider was placed under heightened supervision while we worked with them and completed monitoring activities to ensure that the incident was not indicative of a broader systemic failure, and also to ensure that those potentially impacted by the incident were being well cared for. Even though the Commission's monitoring did not identify any systemic failure in relation to the provider, we continued to closely supervise them through case management to ensure that lessons had been learnt from the incident and any additional controls that might be warranted were implemented. This also enabled the Commission to supervise the provider's management of the older people who'd been impacted by the incident to ensure that they were being given appropriate support. Simultaneously, our enforcement area undertook an investigation in relation to specific conduct of a staff member whose actions were believed to have led to the incident. That investigation resulted in us taking enforcement action against that staff member in the form of imposing a banning order, preventing them from working in the aged care sector for a period of time. So I'll just take you through how that unfolded for us internally as a Commission, because I think that will be helpful in helping to understand how heightened supervision works in practice for us and why that status is important. So through a serious incident report, the approved provider alerted us to an incident that indicated the actions of a staff member may have exposed people receiving care to risk. Due to the nature of the incident, we immediately stood up National Case Coordination, which is a function within the Commission to respond to any immediate risks and the event posed to the safety, health and wellbeing of those potentially impacted by the incident. This period of heightened supervision also ensured the Commission was able to simultaneously initiate a number of different activities designed to investigate and contain risk, drawing on different functions from across the Commission. As mentioned, we deployed monitoring activities to identify any provider-level system control gaps. We undertook case management with the provider on their response plan and to ensure that people who had been potentially impacted were being given appropriate support. And we commenced the investigation to examine whether any of the actions that had led to the incident involved poor conduct. Throughout this process, the Commission continually evaluated and re-evaluated the level of risk. In this case, once we were satisfied the risks were contained, we continued to case manage the provider under active supervision until the investigation was completed. This case highlights the distinction between compliance management on the one hand, which is focused on containing and preventing future risk, and investigatory activities on the other hand, focused on determining whether some form of enforcement outcome should be imposed because of poor provider, key personnel or worker conduct. It also highlights the important role Serious Incident Response Scheme plays in providing vital information and intelligence to the Commission, which we then use to identify events that may require closer regulatory oversight by us. Although in this case, poor conduct was confined to an identified worker, there are other cases where the provider or governing person or person's conduct might also need to be considered. In that circumstance, our compliance staff may closely supervise a provider using the case management approach that I described to ensure that adequate action is being taken by the provider to secure the ongoing safety of those receiving care, while the enforcement team is simultaneously reviewing past conduct to determine if an enforcement action is warranted as a consequence of poor conduct by the provider or governing person or persons. And as Lisa mentioned, we don't do that lightly. I'll now talk about an example of active supervision where we had a provider displaying a high level of risk due to non-compliance with their services, which we identified through an audit of the quality standards. In response to those risks being detected, my team made contact with the provider and initiated case management with the provider's agreement. Initially, they made good progress and demonstrated a commitment to remediating issues. However, after a few weeks, we were concerned that insufficient progress was made and their level of commitment to remediation had started to wane. We explained that if that continued, it would result in us issuing a notice of intention to impose sanctions, commonly referred to as a non-compliance notice, or NCN for short. Unfortunately, that ended up becoming necessary, and they agreed in response to that notice to an undertaking to remedy in response to the notice. We continued to work with them through case management. There was initially a renewed commitment to completing required remedial actions. However, they ultimately failed to deliver on what they agreed to in their undertaking to remedy. This then led to us imposing a 6-month sanction, restricting their access to new aged care subsidies as a consequence of not meeting their commitment. A sanction also moved them immediately to a single star in their star rating system, which is the lowest rating indicating significant improvement needed. On imposing the sanction, we made it clear that as soon as we had seen evidence that they had completed the promised actions, we would consider lifting the sanction. In response to the sanction, the provider seemed to finally appreciate the seriousness of their situation and move to address the outstanding issues. In response to their actions, we were able to lift the sanction a short time after it had been imposed. Cases like this highlight that our goal is always to work with providers if they are willing to work with us. However, if there are promises made that are not kept, or there is emerging evidence of reluctance to focus on promptly addressing the risks we are concerned about, then we don't hesitate to use our powers. Fortunately, most providers are starting to understand that, and as a result, there has been a significant, and I mean significant, reduction in our use of notices to compel action, because providers are taking the initiative themselves. That's much better for everyone, and particularly for people who use aged care services, because both the provider and the Commission are then focusing on actions that will actually improve providers' performance, rather than being distracted by arguments about whether a particular regulatory notice should have been issued. The last case is an example of targeted supervision in the financial and prudential area. We conducted a targeted review of room price approvals and publishing. The focus of the targeted review was to increase the residential providers' knowledge and awareness of the legislative requirements when pricing and charging a room above $550,000 and their awareness of the approval process. Now, for those who are not familiar with room pricing, there is a cap on how much a residential provider can charge for a refundable accommodation deposit, and that cap is currently $550,000 without other approval. We conducted a review with a provider that had 10 residential services with RADs over 20 million. The Commission asked the providers to submit a range of documents as part of the assessment phase. On reviewing the information provided, we found that the provider had charged above the refundable accommodation cap without approval. This was because of weaknesses in their record keeping and governance systems, which had led to them failing to seek reapproval for the room price from the Independent Health and Aged Care Pricing Authority after their previous approval had lapsed. In response, we worked with the provider to assist them to understand their obligations and to oversee the improvement of their governance and record keeping processes to avoid that breach happening again. We also ensured that the provider took steps to inform affected residents of the situation and that appropriate refunds were made to the residents in accordance with legislated requirements. This is an example of targeted supervision where the Commission proactively works to detect compliance risk with a specific set of aged care obligations and then responds where that risk is realised. The goal of targeted supervision is to ensure that the providers understand those obligations and have arrangements in place to meet them. As with active and heightened supervision, our focus is always on the outcome, which is to prevent non-compliance where we can and to respond to it when we find it, to ensure the provider addresses the non-compliance as quickly as possible to protect the interests of those receiving care. I hope you found those a useful illustration of what we're talking about in our strategy. And back to you, Janet.
Wonderful, Peter. Thank you so much. Now we move to the Q&A part of the webinar, and we have lots of questions. Peter, I'm going to keep you on screen as I invite Emma and Anthony to join us to field some of these questions. And thank you to everyone who has submitted them so far, because they give us a smorgasbord of issues to explore in greater depth. Peter, staying with you, the question for you is, will providers know or be told what supervision status they are currently under?
Well, through the process, Janet, yes, because as we engage with providers, they understand through the case management process, we explain to them the level of supervision they're under and what that means for them. So for my group, we manage a combination of targeted, active and heightened supervision. So we are regularly talking to providers. And in fact, when we talk to a provider about their heightened supervision status, that's also to remind them that their issues are wide and deep, and we need, therefore, to be working with them in a variety of different ways, because they can expect to be engaging with us through case management, often with other functions within the Commission as well, to ensure we get them back on track to good compliance.
Okay, thank you. Trying to decide what order to do these in. Emma, I might come to you now. There was a pre-submitted question which was kind of the why question. Why are we revising our regulatory strategy now? We've had one in place for several years. How has it become less relevant? If so, why? And what is this issue about the transitional phasing, which precedes the expectation of the new Act from July 2025?
So in terms of what's changed, that's a great question, because a lot has happened since 2019, as we all know, and the sector's gone through enormous changes at a rapid pace. If we think about what's happened in the last 5 years, we've had the Royal Commission into aged care, which in turn has prompted the department to embark on drafting the new Aged Care Act. We've had the independent capability review, which required the Commission to look hard at where we are and how we build our capacity as a mature regulator. We've had a significant reform agenda underway since then, with the introduction of the Code of Conduct, the Serious Incident Response Scheme, 24/7 nursing coverage, care minute targets, and governing body reforms. So, and of course, we are all getting ready for a new act, which will introduce a rights-based approach, strengthen quality standards, and a new regulatory model. So all of these factors are influencing already how we regulate today, and that is what we wanted to capture in our 24-25 regulatory strategy, which, as Lisa said earlier, we will, as the Act starts to land, we will be looking to update that for release prior to July 2025.
Okay, thank you very much. Peter, I have some more for you, and then I'll share it around a bit. Michelle's asking, what is the process by which providers will be notified that they are either moving from risk surveillance into one of the supervision categories, or possibly moving from targeted into a more heightened or active or heightened level of supervision? And this goes to part of what I think you've already answered, which is we're already talking with them. Do you want to expand on that a bit?
Yeah. Look, I think the big shift with the approach is that our starting point is to engage with the provider. So you won't get a notice in the post as the initial contact. You'll often get a phone call from us, particularly if there is a high level of risk that we're concerned about, and we're starting a conversation with you. So, and as part of that conversation, we will be explaining to you what we need to understand better, and what we need from you as a provider to reassure us that things are improving for those people receiving care. So it will be a conversation, and as I described in the case study, where it goes from there is really a journey that the provider themselves gets to choose based on their response to our contact with them. Because what we're looking at first and foremost is that people are protected and well cared for.
Yes.
So,
thank you.
So you'll find out through contact with us.
Absolutely. It won't be surprised, because there's no point. If a provider is taken by surprise by their supervision category, we have not done our best work in engaging with them to ensure that they are alert to the risks or non-compliance that they now need to manage. Thanks, Peter. Lisa, pre-submitted question. Can you just expand on the nature of the transition approach that means we're branding it as a strategy for 24-25, but also when we expect it to go live, so that people watching and many others can get access to it and study the strategy for themselves?
Yeah, sure, Janet. So the document itself, we hope to have that published on our website towards the end of this, well, around the end of this month. So it'll be available to everybody to have a look at. In terms of how it's already shaping what we do, I think we've heard quite a bit about that already this afternoon. So as Emma outlined, we're really seeing our regulatory strategy as our bridge towards the new Aged Care Act, and it's putting in the groundwork for some of the new arrangements that will need to be ushered in under the new Act, like regulating at the provider level. So I think the key elements that we see in our transition pathway in this year, well, firstly, there's our move to the provider supervision model, and that's a really important one. I think there's probably another significant change in our increasing use of data and information to inform our compliance activity. And I think what you are already seeing in our practice, our really strong commitment to partner more with providers in the design of guidance resources. So we are making sure that that providers are very clear about their obligations and what's expected. And I think the fourth element is probably around, again, our commitment and acknowledgement of the importance of listening to what older people have to say about the sector and the Commission. And I think those 4 things, which are already in play this year, are really a key part of our transition towards the New Aged Care Act. Thanks, Janet.
Okay, let me bring Anthony in here. Anthony, there are some questions of a more practical nature, which I think you'll be up for. And one is, how will large providers be audited to minimise duplication? Lisa talked about us engaging on our regulatory journey with the provider more often now than the service. But somebody's asked, well, what does that mean in practice? Can you just set out in brief our new audit methodology, which ensures that we're not putting services under unnecessary pressure, but that we are also understanding how they are performing?
Thanks, Janet. Yes, and we've been looking at this through the Home Services Regulated Entity model that we've been introducing in relation to quality audits this year. But into the future state, we'll be looking at a provider level audit against the strengthened standard relating to their organisational outcomes. And we'll be doing that just the once, and then looking, if they're a residential care provider, at the residential care service and how those organisational processes are being applied at that level. And if they're home service in category 4 or 5, we'll be looking at that at a service level with a sample of services. So the intent is to gather the information once, and then through requesting that information, look at how that information is being applied at a service level. And we know from our field testing of the new audit methodology that that is well received, and importantly, an important process for us to understand how the function of the audit at that organisational level is being translated into outcomes for the older people. Timeframes for doing that will, of course, be associated with the new Act, but we're very committed in the new regulatory strategy to implementing that as we go. Thanks, Janet.
Thanks, Anthony. Emma, one for you. Brian has asked, where does the performance assessment sit in the strategy? Now, I'll start and then hand over to you. I think what Brian is reaching for is an elaboration briefly of the slide that Lisa used, where we have preventative on the left and responsive on the right. And the auditing approach, which under the new Act will be associated with registration and renewal of registration, is a periodic engagement with the provider. But alongside that, and vital to our regulatory enterprise, is what we do in response to risk. So do you want to talk to us a bit about performance assessment?
Yes. So currently under the current Act, we have a single assessment framework that considers performance against the standards as you've outlined with regard to audit. And we also use that performance assessment framework to look at performance against the quality standards as other risks emerge outside of that cycle. So under the new Act, the audit process is informing the registration of providers. We still use assessment framework with regard to the quality standards to look at providers' conformance. You'll hear some new language there, against the 3 tiers of conformance, minor, major, and conforming. And that is very much in that preventative stream, where we're auditing and interested in how providers are continuously improving, and looking at their responses to any outcomes to audits where improvements may be identified. At the same time, we are moving into a risk-based approach overseen by the supervision approach, which you've heard about today. A risk-based approach will use a range of monitoring methodologies. It has regard to a broader set of obligations for providers, all obligations, in fact. We will continue to apply our methodologies in looking at compliance with the quality standards, but we may also have regard to compliance with other obligations, like principles with regard to restrictive practices or incident management, and prudential standards. So our supervision approach will be using a range of methodologies to do that, and we will be sharing more information about that as we progress that work.
Okay, I'm going to hold you on screen with the next question. Sansan has asked, when will the strengthened aged care standards and this regulatory strategy go live? Now, there are two different answers to those questions. As we know, the regulatory strategy is already being implemented, but the standards are a different matter. So I'll leave that to you to answer. And then, will they be commencing with the new Aged Care Act on 1st of July 25 or earlier? So would you want to unpack that one?
Yes. So as a regulator, we have a regulatory strategy that is in place at all times. We've reviewed our current strategy and updated it for this version that we're sharing today, which is for this bridging year, as we've outlined in 24-25. Certainly, there's a lot of elements of it that we have foresight to the new Rights-Based Act led by provider registration that's going to be coming in a year, which we're hoping means we don't have to change too many things about how we regulate, what we regulate in terms of obligations, certainly changes in some of the instruments we use. But the approach you've heard today under supervision, we want to carry forward. Having said that, the quality standards, the strengthened quality standards, are due to be implemented with the new Aged Care Act. So to be clear, based on what I said, the performance assessment framework remains in place with the current quality standards until the new Act comes in and the strengthened quality standards with it.
Okay, all right. Now I have a question which is either for Emma or Lisa, and somebody has asked about older people receiving aged care. We've talked a lot today, and appropriately, about our engagement with providers, but the question is, how are we going to make sure that new information is accessible for older people who aren't as used to or comfortable with digital technology?
Yeah.
Emma, do you want to field that one?
That's a good question. So we're really committed to providing these accessible information to older people, Janet, in ways that works for them and has regard to particularly the diversity in our community and preferences around receiving information. So we've been working really hard to improve the accessibility of information and delivering in different formats and languages that work for older people. We routinely work with older people to design our communication products and engagement strategies. We understand that sometimes older people either don't want to or aren't able to access information from a website. And so older people who prefer to talk to someone over the phone can ring our customer contact centre. Our customer contact centre can also arrange for translating and interpreting services, which includes Aboriginal interpreter services. So for older people also who may find it difficult to read, they can listen to text on our web pages by clicking Read Speaker Listening button on each page. We're also continuing to communicate our regulatory approach through our regular Consumer and Families panel and other forums that we host.
Okay, good answer. Thank you. Peter, back to you for a couple in your area. There is a question, what methodology, Helen wants to know, what methodology is used for our investigations? Now, I don't expect you to spend the next 20 minutes going through the chapter and verse, but do you want to sketch out the approach we take, which is, it's not rocket science, is it?
No. So what providers have is a group of obligations that describe the types of things that they should be mindful of. So when we undertake an investigation, we're looking at the chronology of events, who knew what, when, where, why, and then starting to form a view about what that means. So it's as you said, Jen, it's not rocket science. I think it's really just about us making a number of different inquiries through interview, through review of documentation, through looking at what would otherwise be considered as reasonable practice, and taking all of that information and then forming a view about whether that suggests that there is a significant shortfall or some evidence of misconduct. Now, through that process, there is a level of procedural fairness that is also given to people who may be identified. So there will be always an opportunity, unless it's a very urgent issue and we need to do something as a safeguarding measure, there is always usually an opportunity for people to consider the reasoning that led to a particular finding through that investigatory process.
Thank you. There's an extension which goes down a particular track, and there's no one online who has particular responsibility for it, but there are a couple of you who could feel this, and that is Deb wants to know how we implement a banning order against a staff member. Now, typically, Peter, it would start with the investigation that you've outlined, which is very much evidence-based, and would also typically include some procedural fairness measures. But at the end of that journey, if through all of that we make a finding that there has been a clear breach of the code of conduct, and or we make a finding on the suitability of that individual to work in aged care, then we do move through that formal step, that procedural step, to ban them for a particular period and possibly in relation to a particular set of services. Is there anything else you want to say about that? I mean, it is a very formal process, and we do take it exceptionally serious because it is the most serious power we have in relation to individual workers.
Absolutely, Janet. And as I described earlier, there are very, very rare occasions where we might need to do something as an interim measure, as a safeguarding measure, where we are very concerned about immediate and serious issue concerning a worker or governing person. But on the most part, we step through this process very carefully as we're balancing our need to protect people receiving care, but also recognising that the worker has rights, a right of reply. So you'll never get to a banning order without a process, and then following us making that decision, there are review processes that a worker can also explore if they believe that our decision was incorrect, because and they're important safeguards, because it is such a significant step, preventing someone from going to work within the sector. But we have an obligation to obviously ensure that those who work in the sector are able to do so safely.
Absolutely. Good on you. All right. All four of you have used the language of working with providers, and you've done so very deliberately because it is part of our regulatory strategy. Lisa, I'm going to put the question to you. What does that mean for us and for providers? What's the experience of that in the Commission and for the providers with whom we're engaging?
Yeah, thanks, Janet. Look, I think there's a number of different elements to this question. We want to build our relationships with providers to encourage the sector to become more open and transparent, and that drives our own transparency agenda as well. And I think the regulatory strategy really recognises that building partnerships with providers to ensure that they're aware of their obligations and the need to make good decisions is really one of the best ways to make sure that older people receive the best care. And incentivising providers to deliver high quality care is also one of the most effective ways of safeguarding older people and ensuring that they have a really positive experience of care. Now, of course, this also involves holding providers to account where they start to demonstrate risk or non-compliance. And if they are able to address those issues quickly and effectively, then as Peter's described to you, happy to support you along that road. But where that's not the case, where there's reluctance or slowness, then we will intensify that regulatory engagement with providers. I think I would also say that we want to build a relationship with providers that enables mutual understanding of our respective roles, which means we'll be honest with you and we'll be really clear when we're worried about something, and we'll be clear about your responsibility to make it right. But we also want to work with providers to champion your achievements, and there are many, and we know that the sector learns best from itself. And I think the final point I'd want to make there is that we are listening hard to providers to make sure that we understand concerns, and where a regulatory response is required, that we're tailoring that response in a way that really helps the sector to understand its obligations.
Okay. You use words including transparency, and they're really important in terms of our relationship with providers, and equally important for providers in terms of the Commission's performance. So Emma, question for you. What steps are we going to take to ensure that we are accountable and transparent in our performance as well? And there are a number of areas that I want you to list here, because I think this is really important for providers to hear that we take this seriously as well.
Yeah, and I think that's reflected in the regulatory strategy. We devote some attention to this because transparency is really key for us. We publish extensive information about our operations, including our annual report, so that older people and providers and workers and the public are informed. We also report on the Commission on our performance as part of our statutory requirements. So we publish our corporate plan and our operational plan each year, and we use our annual report to acquit our performance. The Commission is also accountable to the Minister and Parliament under the Public Governance, Performance and Accountability Act. We expect providers to align with best practices and act in a transparent manner with the public, and we hold ourselves to that same standard by including our detailed performance information in our annual performance statements and in the ways that we communicate about our work. We gather a lot of information and data from reports from right across the Commission, whether it's complaints and inquiries or through other intelligence gathering activities, which help us understand our regulatory impact and to determine how we can be more effective. We're also progressing the implementation of an integrity framework this year. So this is to help us support decision makers across the Commission with robust policies and expert advice. And we consistently engage with our Senate and parliamentary committees, as you know, Janet, and have been audited by the Australian National Audit Office. We have a partnership now with the Office of the Inspector General of Aged Care, which was established in 2023, and all of these things ensure robust oversight to meet our legislative functions, including our complaint handling.
And we will always take them seriously, and we'll always be up for a conversation with providers as to how we acquit our responsibilities.
Indeed.
Lisa, I'll give you the final word. Remind us how we're going to promote the regulatory strategy and where people watching this webinar can find it and when.
Yeah, sure. Thank you. Well, we did start this conversation back at our national conference, of course, back in April, where Janet gave us a bit of a taster in her keynote address, and you might have heard us talking about it in other public forums. But we are, as we said, really committed to publishing a final version of our strategy really towards the end of this month. It'll be available on our website. You can expect to hear about it through social media. We'll have an article in the Quality Bulletin. It'll be hard to miss. The other thing that we're going to do is publish 4 short summaries to pull out the key messaging that we'd like older people and providers and aged care workers and indeed our own staff to understand. So the idea there is for those of you, for some unaccountable reason, who don't want to enjoy the full 40 pages, we can offer you something shorter, but that gives the key messages that we want you to hear. So it'll be on the website, and similarly, in the way that we have with our 24-25 regulatory strategy, we'll be consulting and talking about our 25-26 strategy as we work on that, and that will be available to people ahead of July next year. Thanks, Janet.
Thank you, Lisa, and thank you to all panellists. I think you've risen to the challenge very successfully, and there were lots of questions and we got to a number of them. That does bring us to the end of today's session. Thank you everyone for watching and your patience. I know some of you may have experienced some technical difficulties, but we will have a recorded version of this available to you shortly. So please watch it again or share it with your friends and colleagues. Clearly, it's an important topic, and I do hope you've gained some value from the information that's been shared with you across the course of the hour we spent together. We are very determined on ensuring that we continue this conversation. So you will be hearing further from us. Don't be shy in asking us questions about this. There are a number of months between now and July next year, when, if Parliament does the work that people expect it, we will have a new Aged Care Act, and we will be ready for it. You and we will be ready for it, partly because we will have a new regulatory strategy which is worn in, is operational and achieving the goals that we collectively have to ensure that every older person has an awesome experience of aged care. So thank you everyone for your participation. Thank you to the panel members. Please stay online to complete that very short survey and give us some feedback. And I'll see you next time. Take care. Bye-bye.